Vera Salter is going to give us a few comments on Steve's paper.
Okay, thank you. I want to comment on all that we've heard this morning from a workforce perspective. I want to put it to you that if we can't create a system that works for both consumers and workers, we're going to have a broken system. You know, people have spoken about this as a civil rights issue. It's also a social justice issue for the workforce. We can't expect to have a sustainable PAS system balanced on the backs of workers who are living in poverty. So now I'm going to base the comments I make on evidence. For the last 5 years, I've run the National Clearinghouse on the Direct Care Workforce at the Paraprofessional Healthcare Institute, and we've collected the literature about this workforce as well as best practices. So we have a lot of ideas about emerging practices that can work and can make a difference. And the Paraprofessional Healthcare Institute is committed to creating or providing quality care through a philosophy of quality jobs. And we've pioneered many innovations in practice. In addition, I recently wrote 2 papers for the AARP Public Policy Institute, one of which was on wages, and the other was about the effects on consumers of workers not arriving to work. You know, we have a system of high churn in the workforce, unreliable services, and we have to create a system where the workers are the solution and not the problem. So, how do I go to the next slide? Space bar. Okay. So I have a very simple message. Went the wrong way. Okay, I have a very simple message. We need to pay attention to the workforce. Consumers are demanding and states are providing services in the community. But we know that states have an interest in saving money. I'll put it to you that it's important that they not do this by cutting wages, that states can save money by reducing the overhead costs of nursing homes, but it really is important that the money follow the person, that it truly follow the person. We know that the past workforce is growing while the institutional workforce remains stable. And we need to think about workers who are displaced in this system and are going, even despite the poor working conditions in nursing homes, they're going from full-time jobs, more likely to have benefits, to low-wage, community-based jobs that are part-time with little training and support. So I would put it to you that we'll not be able to grow and maintain this workforce without a concerted policy to ensure quality jobs. And when I say concerted policy, I mean one that works on multiple dimensions. I think we have enough research now to know that there are individual factors and interventions that can make a difference, but we need to use all of these factors together. It's not just about wages, it's also about working conditions and other factors. So at the Paraprofessional Healthcare Institute, we've defined the 9 essential elements of a quality job. First, we need to have family-sustaining wages for the direct care workforce, for past workers. And we know that now, as somebody just said, states know the rate they pay for an hour or a day or a measure of services. We did a survey which showed that very few states know what the workers actually earn. And we've had many examples of wage pass-throughs, other rate increases that don't necessarily get to the wage rate of the worker. So we need to look carefully as we rebalance of how the wage rates work. And I would say that both CMS and the states need to require that states investigate what worker wages are. There are, in addition, many states don't have automatic rebasing or cost increases in their past rates. So they get increased when there's enough political pressure to increase them, but otherwise not. We need affordable health insurance, and that's been touched on by many people. We have a campaign called Healthcare for Healthcare Workers, and over there you'll find a case study that was written about some innovations in Washington State, where they found ways through a Taft-Hartley multi-employer trust to extend health benefits to the workforce. So there are creative methods to get it done, but we need to work on them. We need excellent training. We need career advancement opportunities so people can turn this into a career. We need good supervision, whether it's from a consumer-directed perspective or from a agency perspective. And we have pioneered an approach in coaching supervision that's being evaluated that shows how supervision can make a difference. So basically, the message I want to get across to you is that we need a policy agenda where we pay attention to the workforce and rebalancing. We need targeted efforts to improve the quality of jobs and enhance recruitment and retention. And we need to create the right incentives for quality services, because it's the worker is a person too, and we need person-directed care by persons who have rights.